Hi, this is Dr. Stazan Sina, and in this video I'm going to talk about self-harm. Specifically, I'm going to talk about those individuals who cut on themselves. I'm going to talk a little bit about the factors in cutting, and then I'm going to talk a little bit about how to respond to an individual who is cutting if you are a loved one. Now, it's important to note that although cutting is very serious, it is not always indicative of a suicide attempt, and it does not necessarily mean that the individual who cuts on themselves is suicidal. However, if someone is cutting on themselves, professional help is important and it should be sought out. Okay? So, in order to talk about cutting behavior, I would first like to start with talking about behaviors that are harmful to oneself, that are culturally sanctioned, in other words, that the culture accepts, versus those behaviors of self-harm that are not culturally sanctioned. On one end of the continuum, the culturally sanctioned behaviors, we find things like ear piercing and tattooing. So ear piercing and tattooing, although it's not a sign of depression, it is harm being done to one's body. Now this might be kind of odd to hear, especially in this day and age when tattooing especially has become more accepted in society. These are behaviors nevertheless that are doing damage to one's body, but they are accepted. So those are the culturally sanctioned behaviors. If you go to the other end of the continuum, you have those behaviors that are not sanctioned, that are not okay in society, and are usually a sign of something else going on underneath that needs to be dealt with. Cutting would fall under this category. At the very extreme end, we would find suicide. Suicide is the ultimate self-harm. So it's important to note, I think, that and have a context for where cutting behavior comes from. So let's talk about some potential reasons why individuals may cut on themselves. Two potential reasons jump out at me and that I find with dealing with individuals who cut. One, that it's a way to express otherwise difficult to express emotions. In other words, it helps them to feel, to release, to express in some way due to some sort of emotional numbness or difficulty. When I think of this, I think of the word catharsis, which is the Greek word meaning to cleanse. I've often heard individuals who cut on themselves saying that doing so helps snap them back to reality. It helps to kind of purge them or cleanse them, or to help them get rid of very powerful emotions. And the best example of this I can give you would be to consider old 1940s movies, where the woman typically is hysterical and she's ranting and raving and screaming, and then the next thing you know that happens is usually a gentleman around her smacks her across the face and she calms down and she's back to reality. Well, I certainly don't endorse this behavior. However, the notion is similar in the sense that this pain, this cutting, is a snap back to reality for these individuals. Now, it's not a healthy snapping back to reality, and that's why professional intervention is needed, but it serves that function for them nevertheless. It is also designed perhaps to alert others. If an individual is struggling with powerful emotions, they may have difficulty expressing this, or the individuals that they hope to talk to about this may be unavailable or not understanding. And in this way, if you cut on yourself and you're bleeding, it's a way that you bring others' attention to you, to alert others, to perhaps get a response from others. So this can also be a factor, a potential reason. Another potential reason may be that they cut on themselves to punish themselves. They're feeling bad about themselves. They're feeling negative. And this is one way that they deal with those feelings. Another potential reason is it could be a manifestation or a symptom of the struggle for control in their lives. Struggle for internal control, managing their feelings, managing their impulses. It could be difficulty and a struggle for control with those around them, their friends, or, as is common with teenagers who cut on themselves, a struggle for control with parents. So for teenagers, I quite often see them cut on themselves when they're struggling for independence and their parents and they are having difficulty in negotiating that. So another potential reason. So what are the components to cutting on oneself? Well, quite often individuals who cut on themselves struggle with managing their anger, managing their depression. So those two emotional states are often related. As I've mentioned before, folks who cut on themselves often have a negative self-image. They're feeling bad, they're feeling down, they're feeling perhaps worthless. And this is one way that they respond to that. Emotional regulation issues. In other words, they have difficulty regulating or controlling powerful emotions in general. So you may see some cutting behavior. Impulse control problems. If an individual is not able to rationally control a desire to act out, a powerful emotion, they're not able to intervene cognitively, that is, with their thoughts, before they act, they are going to be impulsive, and they're going to be more likely to do something like cut on themselves when they're struggling with their feelings. Another component to this is what I call the contagion effect. In other words, it can be, quote-unquote, contagious. I have often heard of and have been told about groups of individuals in high school who, as a group, cut on themselves. Now, this doesn't necessarily mean that everyone in that group is depressed or suicidal. Someone in that group is probably depressed, but it is a peer component, a peer pressure of sorts, in that there's a ripple effect in that once one person in the group starts it, others in the group may follow. Cutting on themselves may also be complicated by how one deals with stress. For teenagers, hormonal changes. I always like to think of teenagers in this way, that their brain development is still occurring, and those bridges are being built. However, those bridges are being built over rocky waters. Hormonal changes, hormonal tides are flooding over the bridge as it's trying to be built. So while their brain is going to work, their hormones are actually working against the process. So hormonal changes can be very difficult to manage and lead to more feelings of emotional chaos inside oneself. Another component to cutting on oneself, especially in teenagers in high school, is struggling with social acceptance, social issues, trying to fit in, and being a part of a group. So if you combine that with hormonal changes, stress, trying to become independent with parents, you get a clearer picture of why individuals may feel as if cutting is a way to cope with all of this. So, what I'd like to talk about next is what a caregiver may do in responding to a loved one, to their teen, who may be engaging in cutting behavior. So this is intended to be a brief guide for parents, and it is not intended to be a substitute for therapy. As I said before, not everyone who cuts on themselves is suicidal, and not every act of cutting is a suicidal attempt. However, cutting is still a serious behavior and still needs professional help, and I encourage you to seek out a therapist who's experienced with this. If you do, however, find that your teen or whoever the individual is who is cutting it is seeming life-threatening, that you should call 911 and not hesitate. So let's talk about tending to the cutting injury in the moment. Tending to cutting in the moment. And the first thing you should do is the obvious thing is tend to the injury. Get a Band-Aid, help to stop the bleeding. It's a very nurturing act. Again, if it seems severe and deep, and you don't have, especially if you don't have another professional to call, you need to call 911. Secondly, You need to establish and maintain a connection to this person through empathy and calmness. Try to understand how they're feeling. Try to help them sort through their feelings. And you want to convey a sense of this, of you being in control and you being able to help them. It will help them to calm down. Thirdly, you're going to allow this person some time to vent. It's important to get things off your chest, but to endlessly go on and emotionally just kind of discharge is not helping the person to regain control. So you're going to want to try to do some things to help them cope, to get back into control so they're not feeling awash in these emotions, which would raise the likelihood of them cutting on themselves again. Fourth, as you're talking to them, it could be helpful to try to help them to identify what they were doing beforehand. In other words, the triggers to the cutting behavior. Triggers may be thoughts they were having, maybe feelings they were having, or maybe a conversation or an event that happened in the environment that led to them having difficulty coping and thus cutting. Fifth, I would avoid threats or promises. That is, this isn't something that's punishable. This is something that requires assistance. So punishing cutting behavior is not going to make it go away. In fact, it may make the situation worse. Likewise, you want to avoid promises such as, if you tell me what was going on, I won't tell your father, or I won't tell your mother, or I won't tell your therapist. Because obviously, if someone's cutting on themselves, they're going to need support around them and people to understand. And cutting off their support isn't going to help them. Lastly, and this is related to my last point, when it's appropriate, you're going to let them know that you do care enough to act. If you suspect that they're obviously intending to commit suicide, but you're going to let them know that you're going to act to seek help with this. You need to be a person who can convey control, as I said, and calmness, and to help them with those things because they are likely having difficulty being calm and sorting through their emotions and remaining in control themselves. If they were, would not likely to be cutting on themselves. So with that, I can't emphasize enough the importance of seeking professional help for the person in your life who does cut on themselves. I hope that this was helpful, and I hope that you will join me for future videos. Thank you.